Having mental health challenge could be a handicap for a police officer with ambitions to move up the ranks within the South African Police Service. Mental health challenge can be used to deem an officer unfit for promotion within SAPS. This is according to the Independent Police Union of South Africa, which has called for the resourcing and the beefing up of the health and wellness division within the police service. Senior reporter Ofentse Setimo spoke to Mpho Kwinika of the Independent Police Union of South Africa.
Securing a nation of 62 million people by only 180,000 police officers can be a daunting task. This actually results in some committing suicide and others getting involved in issues of GBV. To discuss this further and to find a redress, I am actually joined now by Mr. Mpho Kwinika of the Independent Policing Union of South Africa. Thank you so much for your time, Mr. Kwinika. Can you just talk to us about some of the challenges that police actually face, especially when trying to keep our community safe? You know, talk to the trauma that they go through, what they actually see that warrants them to actually get some debriefing.
Okay. Look, honestly speaking, policing is a very trying job. Policing is a very trying profession, and in many governments, not only in South Africa, I think in the world, policing, because of this, they have got a team of people that are working with the police officials to ensure that their mental health is up to scratch. So the South African Police Service will need to have this department, which they have currently, upped, and to make sure that it attracts the people, the police officials who happen to have problems when it comes to issues of their mental health.
Absolutely. And I heard you mention issues of decapitated bodies and just the trauma. Can you just mention some of the issues that they actually go through, just to paint a picture of, their daily lives?
Look, when you wake up in the morning and you say, I'm going to do policing, there are various of issues that you come across with. Some of them is the picking up of bodies, which normal people don't want to associate themselves with. You also have to go and rescue people that are in wreckages, and then you find that they have got bodies that are decapitated, and they have to deal with these issues. And at the end of the day, when they are finished with their shift, they have to go back home and face their families. So it is important to make sure that when they are off from these scenes, debriefing sessions takes place.
Absolutely. And I heard you say that, the capacity to debrief actually deteriorated post-1994, but you are saying that the current minister, especially with the current police summit that was there, is actually trying to address these.
Yes, you see, pre-1994, this program, Employee Health and Wellness, it was accessible to everyone. And police officers during that time, they went there at their own free will. And these services were made available to each and every police officers. And at our stations, which I remember very well, between Meadowlands, Orlando and Diepkloof, these stations were clustered, and they will have all of these services around available to them at least twice in a week. So we used to enjoy, going in there so that we can just have, this purification again of your mind, so that you are able to, to continue and do your job as supposed to be.
Absolutely. And they're saying that, because of this lack of debriefing, you end up having a police that's a danger to himself and a danger to society. We've had encounters where there's been GBV, police killing their wives and, committing crime themselves.
Look, obviously, the policing, as I said, it is a very trying time, and South Africans depend on this kind of service. But you cannot unleash to South Africans people whose mental health is not in good order. So it is important for the service to ensure that before they post these people to go and interact with innocent people, they have to make sure that their mental health is in order. And also the issue of debriefing, because I have to put emphasis on it, because when they are done here, if these things goes unchecked, then they will go back home. So they are carrying a problem that they've inherited at work. Now they are taking it home. And the issues that they get from home, they carry them to a working environment. So it will be very dangerous for the service to unleash such people into the innocent people there, who ends up making grievous mistakes, which could also involve the killing of innocent people. The issues such as suicides, which police officers, when they see that it seems like as if there is nowhere else to go, then they think the gun is the only solution to their issues.